Any questions?
What are the questions?
Where's the papers?
Call on people.
What have you identified as the cause of the illnesses at the fair?
It's not quite identified. We have a good guess. It's probably either an allergic reaction. After looking at several surveillance videos, we have found that several kids, it's mostly kids that have gotten sick. Several kids have been doing very unhealthy things in the petting zoo.
How many people were actually infected at the fair?
Many people were infected, not very many, but quite a few, about 15 to 20.
Who was most susceptible? Was it the kids?
Yes.
Kids, okay.
It ranges from 3 to 17. There's one person that is 44, there's one person that's 55. But mostly it ranges from 3 to 17.
Is it safe to visit the fair?
It is very safe. As long as you take some certain precautions, I highly advise that you both wash your hands and stay away from unhealthy foods.
Why do you think that?
Because it is shown in our studies that this affects how you get sick and if you get sick.
Is it contagious?
No, it is not contagious.
What are the chances you're wrong and the real source of the infection is still present at the fair?
There is a very small chance, but I am sure that it's safe to visit the fair as long as, like I said before, you take the necessary precautions.
What steps have you taken to assure the public that other outbreaks won't happen again at the state fair?
Yeah.
Earlier, I talked to the director of the fair. We have ordered several hand sanitizers to ensure proper health. Like I said before, this press conference is supposed to help people understand the necessary precautions that are needed to stay healthy.
Well, what are the sanitary requirements for food vendors at the state fair, and how are they enforced?
They are enforced by their jobs. If they do not follow the health and sanitary rules, they will be fired. I guarantee you that. If they have to wear hairnets, they have to wash their hands very often. They have to have gloves. The people that deal with the money, they're not allowed to deal with food.
I have heard that you have completed your science training at Odyssey Exploration Academy. What skills did you learn there, and what were the most useful in your work on this investigation?
We learned how to do research. We learned how to conduct tests. We learned how to document the tests. We learned through trial and error the things that need to be done. We learned how to learn through trial and error.
There are rumors that the state fair director wanted to cover up this outbreak and asked you to consider a quick, potentially inaccurate response to the outbreak. How do you respond to this allegation?
This is not true. I'm not in her face. I have seen the recent reports. She has been exaggerating beyond any reality. She's been calling the illness, I don't believe it's even an illness. It's probably like a food allergy. It's possibly an illness, but it's also possibly a food allergy.
Have you recommended the food vendor to close down the food booth where this was discovered, or is this booth operating still serving food?
It's operating. I've not recommended that they be closed down. They've been very cautious with their food work and food handling.
What other food products at the state fair harbor these pathogens?
I don't think it's any. I think it's the people themselves and how they deal with the food they're eating.
What recommendations are you going to make to the state fair director to prevent future outbreaks?
Several warning signs. Our team at the Odyssey Exploration Academy, we've created several warning signs. We've done lots of research, and we will ensure that the people are safe.
What are the sanitation requirements for food vendors at the state fair, and how are they enforced?
Like I said before, they're fired if they aren't enforced. They're fired if they aren't done. It's very important. Several people have gone to the hospital, and I believe that is their fault. It is not the food vendor's fault. It is the people that eat the food.
Some people have suggested that the media did not report the accurately or fairly. What do you think?
I think that this is very true. I've looked at the news reports. I'm Interface has been very demanding, very unconclusive, unlike us. She does not know how to do a test and be sure her results are correct. She concluded that the disease was not a disease, but a plague. She concluded that many people have died and that hundreds have got sick, and this is not true. Hardly 15 people have gotten sick.
Okay, ladies and gentlemen, thank you for your time, but this press conference is going to have to come to a close. The doctor needs to get back to his research. Thank y'all. Thank you.